Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Greetings and good morning. Welcome back. I am Nur Sorfina, your presenter and moderator in today's Bicara Sihat show. This is a show that discusses about current health issues in hopes of raising public awareness about general healthcare. Have you ever felt pain or ache in your back? Especially when lifting heavy objects or doing aggressive exercises, but you're just not sure of what's causing the pain? Well, studies have estimated that everyone will experience back pain at least once in their lifetime. In certain situations, lifting heavy objects is unavoidable, but individuals need to be aware of that. If not taken care of, it can cause muscle spasms or a misalignment of cartilage in your spine. In fact, the pain does not stop there. Instead, it can be felt up into the back and in the legs. If that happens, one might be at risk of experiencing neurological problems in their back or even a pinched nerve in the hip. And that is exactly what we will be discussing in today's episode, where we'll explore and gain a deeper understanding of back pain. And to delve into this topic further, we have invited two guests from Pantai Jerudong Specialist Centre who are experts in dealing with back pain. Let me introduce to you Dr. Merlin K, Boban, a medical officer specializing in neurosurgery, brings nearly 9 years of experience into her role. She initially practiced in India 4 years before joining PJC in 2019. Her extensive experience includes treating a wide range of brain and spine conditions, with back pain being a prevalent issue amongst her patients. Next, we have Zurairah binti Haji Abdul Rahim, a physiotherapist at PJSC who has been a valuable member of the musculoskeletal team for the past 5 years. Throughout her career, she has addressed and treated numerous cases of back and neck pain in the Brunei Neuroscience, Stroke and Rehabilitation Center. All right, Assalamualaikum warahmatullahi wabarakatuh, and good morning, Ms. Zurairah, Dr. Merlin. How are we feeling today?
Fine.
Good, yeah.
Okay,
Thank you.
fantastic. That's good to know. So thank you both for joining us today and sharing your insights to better understand back pain. Your explanation will help enhance our understanding of back pain for both our audience and the public. All right, Dr. Merlin, as we know, back pain is a common thing that is often experienced by most people, and it is estimated to be up to 80% people who will experience lower back pain at some stage. Therefore, would you please briefly explain to us what back pain is and what are the common symptoms to back pain? Please, Doctor.
Thank you, Ms. Orfina. So, back pain is quite a common disease which is experienced by a lot of people. So I would say to understand back pain, we would start by understanding what makes up our back. So our back is actually made up of quite a number of structures. I think I'll prefer to use a model to explain so everybody gets to know it better. So it's made of vertebral bodies, the white ones here, which is basically the bones which make up the spine. And then we have the disc spaces in between, which accommodates the disc, or in other words, shock absorbers. And then we have the nerves which pass through the canal here, and also which comes out at different levels, which ultimately innervates or supplies our legs, our urinary bladder, and all the ones below it. So, and not to forget the muscles. So I have put up a picture so that we can see the muscles which constitute. Remember, all these bones are also joined by small joints. So when we talk about back pain can arise from any of these structures. It can be from the vertebral bodies or all the bones, the small joints, the disc, the muscles, and also the nerves. So if you're looking at back pain, it's quite an extensive one.
Yes.
So when we talk about symptoms, it also varies. So if you're talking about a sore muscle, or see you had a strenuous exercise, or you lifted something heavy and you had an incorrect technique or an incorrect posture. So this can be just a simple muscle sprain, or the same things can lead to a disc problem too. It's a lifestyle one, it's not an acute one. It doesn't happen just like that, but it's over the time. So in such cases, back pain is accompanied by radiating pain, otherwise known as sciatica, which means a pain going down the legs. So if you look at the picture, and you can see the color codings over there. So when each nerve is being irritated by the disc adjoining, so the pain goes down that way. So when patients comes up and tells us that specific symptoms, we understand we are dealing with a nerve irritation, probably due to a disc problem. Over the time, or if serious, can also lead to numbness and also weakness, which is felt at certain parts of the legs, depending on the nerves again. Another one interesting is back pain with neurogenic claudication. What do you mean by neurogenic claudication? Yeah, everybody had that doubt. So it actually means that patients come up and say, doctor, I'm not able to walk 10 to 15 minutes. After that, I want to sit down, or I'm not able to stand for a long time. So over the time, it can even worsen, and it can end up like, previously I could do like 10 minutes. Now it's coming down, hardly 50 meters I can walk, and then I have to sit down. So that's another symptom patients come up with. So here we are actually looking at a canal narrowing. So I was just talking about the pathway when it forms, when all these bones are stacked together. So this one is the canal. So whenever there is a narrowing of it, it comes up neurogenic claudication. And one of the common things which can happen is when these two bones, or any of the bones, don't move in synchrony, or like they don't move as a single construct. They actually have a differential movement. That's one of the reasons. It can happen due to wear and tear for older people. Sometimes the younger athletes, or even the army who undergo strenuous exercise, they have a small fracture, and this can also lead to that kind of movements. I hope you understand what I'm talking about, correct? I think the picture adds on. And not to forget, it can also arise from the small joints. In that cases, patients say that I have a point area of pain. Sometimes it goes to my buttocks or the back of my legs. So that's how it presents most of the time. So I hope it comes up to an overview of the back pain. So when we talk about back pain, we do have different symptomatologies, and these tells us what we are actually dealing with, like an insight to it.
All right, thank you, Dr. Merlin, for that very informative and clear explanation. Well, now we know that there is a lot of possibilities as to why we experience back pain. So, and that pain is at this point just merely a warning. So then what would your approach be to managing back pain from a doctor's or a medical's point of view?
Thank you. I think I would take this opportunity to say that not every time when we do the back pain, patients present with back pain, we don't really have to go with imaging. But when the symptoms are quite clear and quite extensive, and depending on the nature, as I was explaining, like back pain with radicular pain, pain going down the leg, or back pain with a neurogenic claudication, and all of these things is quite specific. So then we opt for appropriate scans, so we can confirm what we are dealing with. It can start with X-rays. Sometimes we opt also for CT scan. Both X-rays and CT scan give us an idea about the bone, and we opt for MRIs when we have to know about the disc or the muscles or the nerves or the canal, as I was showing it just before. So that's where we do an MRI, and then once we confirm, that's when we decide on how to treat the patients. So it's not always we go for a surgery. There are conditions where we just treat conservatively. Conservatively is usually a term used medically, but it just means we give medications to alleviate the pain. It can be painkillers, also pain modifiers. When it is absolutely necessary, then we go for a surgery. So this one is a small disc, as you can see. Does not necessarily this patient has to go for a surgery. And if we go ahead and find a big disc and the patient is in severe pain, the nerve is totally irritated and it goes down the leg, it affects his daily life, and it's not getting better with painkillers over the time. And you can also see sometimes the patient have specific area of numbness and weakness, clearly indicative of a surgery, like a discectomy. We remove whatever is coming into the canal and causing all the irritations.
Yes.
Okay.
I see. Surgery. That sounds serious, doctor. Well, but the approach does differ from what type of pain they're feeling, right?
Yeah, exactly.
So not everyone requires surgery, but it is an option. How about from a physiotherapist's perspective? What would your main treatment would be for people suffering with back pain?
Thank you, Sarfina, for the question. So when it comes to physiotherapy, it depends on which stage they are at and what symptoms they have. So when it comes to period of time, we see it as acute, which means the pain that lasts less than 2 months, or even could last just short term. It could be a week or 2 weeks or just up to months. And the second category is chronic or persistent pain, so pain that lasted more than 3 months. So when we're talking about acute pain, we are focusing mainly on how to manage the pain. So pain management is such a huge role in treating acute pain. So one of the examples to treat the pain is via modalities. So if I'm going to show you, these are just some examples of electrical stimulation. So if you could see here, there are patches on the back. So it's actually the patch that's attached to an electrode, and it would give an electrical stimulation. So there are different kinds of electrical stimulation. This is called TENS. There's another one called interferential current, and etc. Also, that we do have dry needling as an option as well. So it might look like acupuncture, but it's actually, they're two different things. Dry needling is focusing more on the nerves and muscles. Yes, it's more for relaxation or nerve stimulation. But again, it's acute. It's for acute pain. It's just for short-term relief. The other thing that we're focusing on is exercise. I know it's a scary word for a lot of people with pain, but for acute pain, we're just focusing more on stretches and gentle movement, just to get them moving. Basically, that's an overview of how we would approach acute pain.
Well, now that you mentioned that they can do gentle movement with stretching or exercises, would you like to probably explain or demonstrate the exercises?
Okay, thank you. I might not be able to demonstrate, but I think you can copy from the photos that I'm going to show you. So stretches, it can be done on your bed or on the mat, so you don't really have to get out of bed to do these exercises. And of course, these stretches are just an example for generic back pain. But again, we have to get you assessed. We need to test out your muscles, your strength, because some people with back pain do not prefer certain movement. So some would prefer like more into upright position, or some prefer into more of a bending or crouching position. So we would assess and then tailor the exercise to the patient. So when it comes to stretches, the main goal is to relax the muscles. So why relaxation is important? So when you're in pain, especially new, like a week or 2 months, a month, when you're in pain, you tend to tense up, isn't it? So I would like the audience, or even Dr. Merlin and Sarfina, to try tense up, make a fist with both hands, and try to tense up. Kuat-kuat genggam, kuat-kuat macamkan tubuh orang, but jangan tubuh orang, please. So kuat-kuat genggam, and I will tell you to let go when I tell you to let go. So you will let go when I tell you to let go. Okay? Keep on,
Alright.
keep on pinching, keep on
Okay.
let go. Okay, you can
This
feel
is
it now.
interesting.
It's not even a minute yet. So stretches really, really are important as a part of relaxation. Keep on the fist, keep the fist. So yeah, when you're in pain, you tend to really tense up your muscles because it's a normal reflex for those in pain. It's a protective mechanism, which is normal. But now you can relax. So how do you feel when you relax it?
Ugh, that
It's like
hurts.
let go.
Yeah,
Now you realize that it actually hurts to tense up.
Oof.
You know?
Yeah.
Yeah.
That's
So
true. Yeah.
stretches really help with relaxation. Apart from stretches, you can also do some breathing exercises.
Yeah.
It sounds simple, it's like breathing in and out, but there's specific technique to it as well. So yeah, mainly relaxation in the first few phase when you started feeling the new pain, you can focus on stretches mainly.
Yeah. Well,
Physiotherapist actually plays a big role when it comes to in the acute pain management,
yes,
and also
that's
when it
true.
comes to a long-term pain management. It's a big part of the treatment.
Because they mainly focus on the long-term goal. Yeah.
And
So yeah, that definitely gives us a clear idea of what it feels to strain a muscle for that long. And thank you, Ms. Zurairah, for that demonstration. And I would like to ask now, Dr. Merlin, you mentioned something earlier about getting scans a while ago when someone is having a condition with back pain. So at what point in their condition do they require scans for people with back pain?
So I was actually mentioning before that investigation or imaging or scans is a part of identifying what the problem is. But when the patients present to us, we don't per se have to ask for scanning upright. When the symptoms are more specific, like we're dealing with something serious, yeah, the scans are asked upright. But if we, after understanding the nature of the pain and also after checking on the patient, we understand that sometimes it might be better with conservative treatment like painkillers, physiotherapy. So we give a trial of this first. But more if the symptoms are specific or there is progression of symptoms like numbness or weakness, or if there is a clear history of strong trauma, or there is the patient says that there is sharp shooting pain going down the legs with numbness at the buttocks, problems with passing urine, like the patient doesn't feel that he wants to pass urine, but it's been a while since he has passed. So there are quite red flag signs which we look into, not to mention about the constitutional symptoms like fever, and then chills, can have weight loss. All these, it might, and we might be dealing with more emergency situations. It might be infections, or it can be part of another process too, like can happen in tumors and all those things. So depending on the symptoms, we actually time the scan. So there is no harm or there is no rush to actually do a scan, but if there is clear indications, we do rush for the scan too. Yeah.
All right. Red flag signs. Those are the symptoms when things get too severe, is it?
It can vary. Like major trauma is one.
Yeah.
Back pain for age less than of 18 years. Or there is, I was saying about the sharp shooting pain going down both the legs with numbness at the buttocks area. And then there is progression of the numbness or weakness. And constitutional symptoms, I was saying fever, chills, weight loss, or other related symptoms are also there. So in such cases, they are quite a red flags.
Yeah, they're red flags. So those are really serious signs, and really need to look forward for those red flag signs. And then when you do experience these signs, please seek immediate help. And I would like to ask as well, how is the approach different than those in acute or a new phase? We would like to get opinions from both sides.
So when patients are with us for quite some time and the pain is not getting better with our initial approach, so we need to go for a re-evaluation. We look into the nature of the pain, if there is any change, if there is progression of whatever symptoms the patient is telling us about, maybe like weakness or claudication pain, things have worsened for the patient. And in such cases, we do request for repeat scanning to make sure that if the disease have progressed, like there is a worsening of listhesis, the one I was showing with the differential movement with the vertebral bodies, or there is a increase in canal narrowing. There are a few changes we can compare with our previous scan to the scan now, and then we can assess the symptomatology of the patient, like is it worsened or is there some red flag signs coming up. In that cases, we look for if a surgery can benefit the patient. Not all the cases, but sometimes do patients progress and they do benefit with the surgery. So one such surgical procedure is this, in which we fix the moving bones. There are conditions where there is no clear indications for surgery, and patients then can still benefit with the painkillers or the pain modifiers. There are two different types, and then physiotherapy plays a big role here.
So what about the physiotherapist, sir? Do you have any additional add-on to the comments to add on to this question? She has a lot.
I think we're going to spend quite a while talking about persistent pain. Thank you, Dr. Merlin, and thank you, Ms. Sofina. So when we're talking about pain that lasts more than 3 months, we label it as chronic pain. So chronic pain is not the same as severe pain. So chronic meaning it's just the period of time, so lasting more than 3 months. Severe means how bad the pain you're feeling. So like if you could rate it 0 to 10, 0 means no pain at all, 10 being the worst pain you could ever imagine, like it's hard for you to move, then severe pain is towards that end range there, like 80 to 100% of pain. So when it comes to chronic pain, as Dr. Merlin mentioned earlier, back is quite a complex structure, and chronic pain is quite a diverse and extensive areas for us to explore, because once we've passed that 2 months phase where the body is already healing, already recovering, but the pain is still there. We would usually see it as, pain does not always indicate that there's an injury ongoing on your back. As Dr. Merlin mentioned, they've done re-evaluation and there's no serious condition. That's when we need to explore other factors. So other factors could sometimes be a psychosocial factors. So meaning, it could be stress, it could be anything, anxiety, even the way you believe about your back or pain. So fear could play into a role when it comes to chronic pain. And when it comes to persistent pain as well, it's how your brain understands the pain and how your nerve is kind of receiving it on the other end. So usually the nerve can be sensitive. That's why the pain lasted more than 3 months. So if you imagine this nerve, urat saraf, if you imagine this nerve, it's like a volume knob, and then the volume knob is being turned up all the time. So any movement, even trying to bend down, picking up stuff, can feel pain when it's
aggravates.
It aggravates. So it's not a harmful movement, but then it caused more pain. So the nerve can be sensitive in that way. The volume is turned up. So our goal in physiotherapy, we want to explore what are your aggravating or what are your triggering factors that made your back pain worse. And then from these factors, whether it's psychosocial or biological, for example, what they found on the scan, or sometimes they don't find anything from the scan, so it's called non-specific. Or even maybe from our side, we would check your strength, your muscles, or your movement. And then if there's any weakness there, then we can go for exercises just to, tailor with the strength part. Treatment are the same. The treatment for persistent pain is similar to acute, using the electrical stimulation or dry needling, but it wouldn't be as effective because it's a short-term relief. Because it's already past 3 months or six months, 1 year, you still have the pain. These modalities, like dry needling or TENS, wouldn't be as effective if it's not done together with exercise.
Yeah.
So it needs to be coupled together with exercise.
That's true. So yeah, just because it's a fast solution does not mean it's effective in the long term, right?
Yeah, exactly.
So, but people do express fear in pursuing exercise, especially when they're in pain. No one wants to start exercising, bending down and everything when they start to feel some pain, right? So, Ms. Zurairah, what would your advice be towards those people who are scared or maybe anxious to start exercising when they have back pain?
That's actually a good question. Who here feels the same way? I'm sorry, you guys are so young. I'm sorry, you guys are quite young to experience back pain. No, young people can experience back pain as well,
Yeah.
Especially IT, in IT or admin work, or even those who move around, nurses.
Yeah.
And whenever you have pain, of course, it's quite fearful to move. It's understandable that it's scary to move, but there has been a lot of studies and research to show that exercise is safe and it's actually recommended for back pain recovery. And when it comes to exercises, what I would advise would be start with something that you enjoy doing. So it could be brisk walking or even dancing, gardening. So gardening, not water planting. So gardening, like planting.
Planting? Plant.
Water the plants, right?
Yeah,
watering the plants. I'm sorry, my English. Apart from like brisk walking, dancing, in terms of gardening, watering the plants is not included. It could be included if you're, if you're not as active. But gardening, meaning like the heavy labor of, menyangkul.
Yeah.
However, once you start feeling more confident in doing your favorite activities, then maybe you can also start with strengthening exercises. So strengthening exercises, yes, going to the gym, but it could also be done on the mat. So you can start as simple as this, like going on a plank on your forearm and your knees, and then the bridge, dead bug with gym ball. But bear in mind, you still would need to get assessed by a physiotherapist on your movement and symptoms to get the best exercise tailored to your symptoms. So this is not for everyone, but this is a generic exercises that you can do at home as well. I would like to add a little bit more about strengthening exercises because I feel like this is the main thing that we do for back pain actually. So you could also do some wall squats, sit to stand with weights. So for those who have difficulty moving, you can even start with sit to stand. If you don't feel confident using the weights, you can just do it without. Wall squat, you don't have to use the gym ball. You can even just, wall squat normally as well. And when you feel more confident, or when you're with a physiotherapist, especially when you are dealing with work that involves a lot of lifting, I think this deadlift would be one of the most common exercise that you can start with. But of course, learn the proper technique and start small, start slow. Start small, start slow, and understand your body. Basically, generally.
When you mentioned about gardening, so like shoveling soil and everything, like planting new roots or something. So that's basically like an everyday activity as well, right? And instead of just focusing on going to the gym, you could do it at home, at the mat, yeah. So it doesn't necessarily mean aggressive exercises that you need to go anywhere. It could just be an everyday thing, but just make your body active in a way, right?
Yeah.
So yeah.
I would like to add on more about the daily activities, if that's okay.
Yeah, sure.
So when it comes to like when we're talking about persistent pain, again, another main goal for us would be for them to regain their confidence in doing daily activities.
Yeah.
So some people with back pain would experience like pain when they were cooking, you know, standing for too long.
Oh, yeah.
So we would teach some strategies on how to, you know, being able to manage that. As well as, you know, as simple as like carrying a laundry basket, or if we're talking about work-related activities, we can say, for example, nurses would be handling a lot of patients, you know,
Lifting,
transferring patients from one place to another, like bed to wheelchair. So that would take a lot of strength and you know, technique, right?
Yeah.
So we would actually train and teach patients how to manage their daily activities, even with the pain.
Oh, that's interesting.
And medically, the strict bed rest is usually advised to patients who are dealing with fractures, mainly the unstable ones. Otherwise, it's an active rest.
So like for more serious condition, bed rest.
Bed rest, when we are dealing with an unstable fracture, can happen in older people because of the bone strength is low, can happen in younger patients when they have a major fall. So when it is unstable, that's when we ask for a long, strict bed rest, but provided they constantly move their legs, it should be still active. It's only the back we are resting. But when it comes to the other back problems, usually it's the active rest we advise.
So moving your body doesn't necessarily mean moving your back or moving your spine. It could just be moving your arms, moving your legs. Thank you, Ms. Zurairah, and thank you, Dr. Merlin. Well, we now know by now about the causes and symptoms of back pain. What about the complications if someone has back pain and is not treated properly?
Here it can, back pain can arise from a quite number of reasons, as we were looking into earlier. If there was a constant severe compression on the nerve for a long time, it affects with the nerve area which supplies, like it can have the numbness and the weakness, and it can worsen. Weakness doesn't mean it's just a subtle weakness. It can actually go to quite a severe weakness. And if untreated, like conditions where you have urinary retention, like patient is not able to pass urine, but they take a while to come to. So there are conditions which is quite significant when there is fever with chills, with back pain, weight loss. These conditions, I don't think we have to be waiting. We need to look into if we are looking into something quite serious and would need urgent medical attention in that cases. So I would suggest if there is a back pain and it's giving you quite significant effect in your daily activities, there is progression or like worsening of your numbness, your weakness, there is fever, chills, you have weight loss, there was a major trauma before. All these cases, I would say, get the attention early, so we are not worsening the situation.
So seek immediate attention. So you've touched on surgery a while ago, the scary surgery. For those who had undergone surgery, like you mentioned before, fixation, the fixation that you mentioned, does the implant stay in the body for a long term, or do you take it out at some point?
So we usually use, it might sound scary, but it's not per se like that. It really helps you. So we use the screws and the rods to actually put the bones into place, or to avoid the movements between them. So it is also done when there is fractures. we need to fix the spine, unstable ones. So in these conditions, we per se don't have to remove the screws of the rods. It's usually made of titanium. It's an inert metal. It doesn't react with the surrounding structures. It will be there as it is. Per se, we don't have to remove it. We don't opt for another surgery to go back and remove it. There's no issues having it in the body. Yeah.
All right, this has been an insightful journey, learning and understanding about back pain. Thus, to conclude, maybe our guests would like to give some advice or key takeaways for the audience to consider on the next steps in preventing the issue from becoming serious.
We should always look into the holistic approach of the back pain. There is no reasons to be panicking, but as I was mentioning, if the specific symptoms and it is affecting your life, there is quite a reasons to be afraid. So if you are worried about your back pain and if you cannot get a grasp around it, I would advise to sort of medical attention so that the doctor can help you guide through, make you understand how it is, and per se maybe reassure you, maybe just a reassurance or a lifestyle change is enough for you. So that's how we go about. And then when it comes to surgery, when it is absolutely necessary, don't be scared to go with it. It's gonna really help you with your life. Starting with a simple discectomy or a spine fixation, it might sound extensive, but the effect it gives to your daily life, the pain relief, the numbness, the weakness, everything. I wouldn't say completely resolved, but it depends also. But it significantly affects. We do have patients after surgery, if it is simple procedures, they're walking the next day. Risks do happen, but there's quite a lot of benefits to it. So I would say, if you are worried about your back pain, sort of medical attention, so we can guide you through it. We can we can clear your doubts. If you want to have a scan, we can let you guide through if you really need it or you don't need it, or how lifestyle changes is required in your life, or if a surgery is advised.
Perhaps Ms. Zurairah would like to add on to the advice, maybe some tips on preventing the back pain?
Yeah, sure. Thank you, Ms. Safina. First things first, strengthening your body, generally your legs or your back, would work wonders for the pain long term. And if you are gonna opt for, any electrical stimulation or dry needling, it wouldn't be as effective if you're not gonna do exercises together with it. And generally, exercises are safe to do, whether if it's a new pain or old pain. But we also need to explore other factors, especially in persistent pain, what could contribute it. So looking into psychosocial factors, as I mentioned, stress, anxiety. If you're working in a prolonged sitting or standing work nature, or lifting heavy weights repetitively, learn the correct technique, get your body stronger, or go to a physiotherapist. That's all from me.
All right. Okay. Thank you both for the thorough explanations about health issues that we talked about this episode. Your insights were incredibly informative and helpful. We appreciate Dr. Merlin and Ms. Zurairah for their valuable contributions. Okay. Alhamdulillah, our guests have given a comprehensive overview of today's health issue. Before we conclude today's talk show, we'd like to open the floor to questions from the audience here in the hall. Feel free to ask our guests any questions related to the health topics we've covered today.
Hi, Assalamualaikum. So my name is Nursadrina Farzana and I'm from Kemudian Institute. So my question is, you mentioned earlier that the causes of back pain is stress and anxiety. So how can we relieve the back pain caused by the stress and the anxiety? Thank you.
Thank you for your question. So stress and anxiety as contributing factors itu just a part of it, But if you know that the stress is actually triggering your back pain more, then usually we would offer, like, if you would be willing to talk to a professional in how to manage your stress or how to manage your fear and anxiety lah. And see if once you manage your stress better or anxiety better, and see if that actually relieves the pain a little bit. So again, it's one part of it. Not everyone would be triggered by stress, but if you know that, for example, during exam time, yata ni rasa lagi sakit. So that's when, we offer lah, like, are you ready to talk to a professional just to get an idea on how to know the strategies how to manage stress or anxiety or the fear.
Assalamualaikum. My name is Azrin from Pemuda Institute. My question is, what is your opinion of chiropractic if you have a sharp back pain at the middle of your back?
So if we recapitulate, when a patient comes to me with a back pain, it's not directly going through physiotherapy. First goes through an assessment. If it is a conservative, if it is a mild thing, after our assessment, we refer to physiotherapy. The same goes with any other approach to alleviate your pain, because we need to have a better understanding of your pain. Yeah, of course, if it's a muscle sprain or a trivial thing we are dealing with, the way Ms. Zurairah was explaining, she do use quite a number of modalities to alleviate the pain. The chiropractor might help too, but if we are dealing with something severe, it might not be the case. As I was explaining, there are patients coming to us with large disc, with quite a significant listhesis or maybe a fracture. So in such conditions, if we actually go ahead with blind procedures, it might not be. It's quite a blind approach there. But if the way the physiotherapist does, once we have assessed and we know it's quite a trivial one, there's no harm using different modalities actually to pain relief. But I would say better understanding is the first thing to do. Investigation might be needed too. And if you're saying if it's a very specific pain, I would suggest investigate first.
I think I would like to add that as an answer. So we wouldn't say that, we wouldn't recommend, but usually bone setting or chiropractic is usually a high manipulative technique. So you imagine bones, cracking the bones kind of thing. And imagine if you blindly go to a high manipulative technique as a treatment, but knowing that you've got listhesis like this, it would be a risk factor. But however, some people feel relief with chiropractic, and there's no harm to try out, but again, it's your risk to try. That's all.
Okay, Assalamualaikum. My name is Vitrisha. I'm the lecturer of Pemuda Institute. I have a question. I have a back pain before. This has happened because of the 1 week of heavy teaching hours. I have 2 to 4 hours of teaching, and then at the night, at the bed, I cannot wake up like half an hour because of my back pain. Is it because of the hourly standing, or because of the overweight, or because of the food that I take? Thank you.
Thank you for the question. So when I was listening to you, you were already telling me that you did have a strenuous long standing. You feel you're slightly on the overweight side, your lifestyle. So I would suggest you to do necessary changes in your lifestyle first. You can definitely give a trial and see how is your back pain getting better. Yeah, we advise the patients on losing weight, core body strength, proper posturing, and stretching, and the related exercises accordingly. And if you doesn't per se have red flag signs, you can definitely go and try out your lifestyle modifications and your exercises to begin with. But if you're not getting better, then we might be dealing with something more serious. Then you would need investigations, starting with a simple blood test, x-rays to understand your back, and if necessary, only further imagings. But I would definitely say to everyone who is listening, lifestyle play a big role, and it's not just the medical comes very last. So it's always your own responsibility to actually keep the lifestyle, proper posturing, proper techniques, adequate stretching, core body exercises. Even when I work out, there was a time when I asked her for advice because I was finding it difficult, and I felt like, am I straining my back? Because after the exercise, I feel my back is tight. So I feel like it's not right. So she did guide me through on how to actually properly do it when I'm doing weights. And it did affect me. It was too good. It was quite strengthening. Confidence came up, and also my techniques also changed. So I don't feel that strain, the tightness at the back. I also feel it. Every time I sit and get up, I feel like, oh, it's tight. So I felt like it's not right. So I asked her for advice, and that's how I went about. Thank you.
Assalamualaikum. My name is Muhammad Ali Shami from Kemudian Institute. And my question is, depend on the sleeping posture, which one will cause back pain, mostly cause back pain? Thank you.
Thank you for your question. So when it comes to posture, whether it's sleeping, standing, or sitting, there's no perfect posture. Because if you think about like trying to get into the correct posture for a long time, same thing with the fist, you're just straining it, you're just tensing up. So when it comes to sleeping, there's no specific posture that would cause the pain or relieve the pain. Find the posture that feels most comfortable for you, and that would be the best sleeping posture for you. So there's no like a right or wrong how to sleep in terms of sleeping posture. But when it comes to like prolonged standing or prolonged sitting, we would advise taking breaks in between. So every 30 minutes or 1 hour, try to move about, or if you can't get up, just do some light stretches in sitting. I think I have a photo for it too. Something that you can do now, yeah. So just reaching forward, sideways, or even rotate your trunk. Do some stretches in sitting, and I think it will be alright. So there's no perfect posture even for sitting, standing, sleeping.
Assalamualaikum. My name is Rabiatul and I'm from Sufri. My question is, what are your opinion on people with back pain resort to use body massage or blood cupping service to relieve their back pain and fatigue?
Do you want to answer it first?
I think it's more appropriate for you. You're the specialist there.
So body massage or cupping, there's no harm. If it helps you, then you can go for it. If it doesn't help, then just stop. So there's no harm for you to go for it. That's all.
Okay, so thank you all for those questions. That was all very interesting, very informative answers from our guests. We have one more questions from the QR code, which is someone has asked, I am a 65-year-old lady who is diabetic with high blood pressure, and I do a lot of housework and has been feeling a recurrent lower back pain for a month. What do you suggest is the treatment, or what do you think is going on, doctor? That's the question from her.
Thank you.
Okay.
When I was listening to you, she's quite concerned about her back pain, and she's mentioning that it's a recent change. So she was diabetic, hypertensive, that's a long story, but she's experiencing a back pain for a month, and she's doing the same activities as before. So this is something new. So this needs investigations to begin with. I'm definitely sure if she's coming up with a question, it's affecting her daily activities. So it's a clear indication to look through it. As I was mentioning, we need to know the nature. Like, I would like to get a bit more information on it. Like, is she experiencing pain? She's not able to walk long distance, or she wants to sit down very fast. Standing is an issue for her now, or certain area of numbness or weakness. I would like to explore it more, and after that we can have an investigations like x-rays to see how her bones are doing. 65-year-old female, they tend to have their body, the bone strength to be quite less. Patients even benefit with the replacement of the calcium. So that's another one we look into usually. So x-rays do give an idea about the bone strength. That's a trivial one, but there are further investigations to go through. So we can start with that. If required, we will proceed with further one. We can give a trial of pain management, see how she is getting better. Definitely, if there is quite a significant one we are dealing with, she's going to come back with the pain. So in such cases, yeah, we are going to investigate her more further and then take accordingly. Yeah.
Okay. All right. Thank you to those who have asked the questions. That was such a great turnout of questions. And thanks again to our guests for the clear explanations. Well, based on the explanation we've just heard, it's clear that back pain is generally not due to a serious issue. The first and perhaps most practical step to reducing back pain is to make some lifestyle changes. Observe any activities that may cause pain and then consider modifying them. But if it hurts too much and lasts for more than a few weeks and has other symptoms, seek immediate help. Get an examination and an appropriate treatment to minimize the risk of long-term back pain. Thank you all for joining us today. I hope you found the talk show beneficial and insightful just as I did. That wraps up our session for now. Be sure to tune in for the next episode in the Bicara Sihat show, where we'll explore more health issues, topics for the benefit of everyone. And remember, prevention is better than cure. This has been Nur Sorfina, and I look forward to our next meeting. Assalamu alaikum wa rahmatullahi wa barakatuh.